www.healthcmi.com. Today, acupuncture beats drugs for IBS relief. This was published at healthcmi.com on August 22nd, 2019. Acupuncture alleviates irritable bowel syndrome symptoms and reduces IBS, that's irritable bowel syndrome, recurrences. So, Pu'er People's Hospital in Yunnan, China, researchers conclude that warm needle acupuncture is clinically effective against type D IBS. That is the type of IBS that is diarrhea or loose stool predominant. A 6-month follow-up after completion of acupuncture treatments confirms lasting improvements. Total effective rate in the acupuncture group, 97.96%. Total effective rate in the drug control group, 83.67%. The 6-month follow-up in the acupuncture group was a 6.12% relapse rate. Not too bad. And the drug control group, the relapse rate actually was pretty high. It was 24.49%. If you go to healthcmi.com, click on news, and look for this article entitled Acupuncture Beats Drugs for IBS Relief, you'll see the exact acupuncture points used, how many times per week, how it got done, a breakdown of what types of improvements. Let's look at a few highlights. Now, total effective rate is interesting, and it was very high at 97.96%, but it really doesn't tell the whole story. So, in the control group, 20 were completely cured. 10 had markedly effective, 11 effective, and 8 ineffective cases. So those are the people who had the drugs. Now, in the acupuncture group, they had 30 cured. So that's as opposed to 20 cured in the drug group. So that's much higher. 10 markedly effective, 8 effective, and 1 ineffective, giving a total effective rate of 97.96%. But what's important is that the cure rate is significantly higher. What's also very important is that the relapse rate is so low that acupuncture has kind of a long-term result. Now, I've been an acupuncturist practicing in clinics for over 27 years. The problem here is laid right out in the study, because in order to achieve results like this, patients need frequent treatment up front. And that type of time or energy or money or access to care can be difficult for a lot of patients, especially when they're somewhat anemic, or what we say blood deficient in Chinese medicine, or qi deficient, due to the exhaustion from this condition. They might be having trouble just getting to work with enough energy, or going to school with enough energy, or both. So let's take a look. So they used relatively fine, short needles. That's normal, because people with irritable bowel syndrome tend to do better with very gentle treatment, as opposed to something more robust, let's say like a shoulder injury, where something would be a much more robust treatment. People who tend to do better with finer or shorter needles tend to be people who are qi deficient or blood deficient in Chinese medicine, so things like fibromyalgia and IBS. So they used a balance reinforcing reducing technique, and they did attach a 25 millimeter piece of moxarol, IE, or moxa. Mugwort is the herb you attach to the needle handle, just to send a warming sensation through the needle. I will actually say it's quite lovely. It's a wonderful feeling in and of itself, but what it does is it warms the needle and enhances the treatment. And that was attached to stomach 25 Tianshu, which is approximately 2 inches to either side of the navel, the belly button, and Guan Yuan, which is CB4, which is below the navel. And that nice warming sensation feels very good on the stomach. It's also good to fight pain. But here's the rub. One course consisted of 5 days of treatment, so 5 days in a row. then a 2-day break, and then they kept doing it. So 4 courses of care. So 20 acupuncture treatments, 5 days in a row, 2-day break, 5 days in a row, 2-day break, and so on for 20 treatments. And that level of access to care is very difficult. But that can be exactly what it takes to get someone better. So these are community-based issues where people need access to someone with experience in this type of acupuncture that can deliver this 5 days in a row with 2 days off, etc. Now, granted, if someone came into probably, I would say 3 days a week minimum, could achieve optimal results as well. But there is considerable expense if someone lacks health insurance, for example, if someone doesn't have good transportation, if scheduling is difficult with their work. So to really achieve the results in this study, someone literally has to do 5 days in a row, 2 days off for a total of 20 treatments. There is a difficulty there. The outcome measures are excellent, and they are consistent with what I've seen throughout my career. So throughout the decades of treating people with IBS-D and IBS-C, which is constipation. There's another type called it's D and C, which is kind of mixed. Sometimes it's dry stool or constipation. Sometimes it's loose stool and diarrhea, and it fluctuates between the two. That's another type. Especially for IBS-D, yes, if people can get frequent care on a consistent basis, what they're saying is at the 6-month follow-up, they have excellent results, and that is true. Now, what we're finding from the studies, though, and which this study doesn't cover, is that if you do the concentrated treatment here, the 20 treatments, and then you do once a month acupuncture follow-up for the next 6 to 8 months, you're going to get results that last much, much longer. So take a look. Go to healthcmi.com. I think you'll find this very rewarding and important for people suffering from this condition. Thank you for listening. www.healthcmi.com.